every time I go on a road trip with an ICU patient. I swear I can have everything like this when we start the road trip and everything will be like this when we end the road trip. To be honest, I wish I had some magical advice about how to avoid things getting all tangled up during road trips, but honestly, I feel like it's just part of the process. But I do want to cover some road trip etiquette, so to speak, for safely transporting ICU patients outside of the ICU, whether that's to CT, MRI, or another procedure. Because whenever you are traveling away from home, we need to make sure that we are safe. First things first, whatever drips your patient is on, make sure that you have enough volume in the bags. And if you need to bring any extra bags or any additional medications, make sure you have those. You're also going to want to bring your emergency equipment like your bag valve mask and portable suction if you need it, or any other emergency drugs that you possibly might need. You want to make sure you have enough slack on any tubing, whether it's IV tubing or ventilator tubing or anything like that, in order to transfer your patient from their bed to a stretcher or bed over to the CT scanner, etc. If you are unsure if your patient can tolerate laying flat, trial it at the bedside before you go anywhere. So much easier to lay your patient flat in their ICU bed when you are back in your home unit and realize, oh, this patient can't tolerate laying flat very well. We need to, give them more oxygen, or maybe they need a different type of respiratory device, or maybe they need intubated. Whatever it might be, it's a lot easier to do that at the bedside than it is to go to CT, go to MRI, lay your patient flat, and now you're putting yourself and your patient in a potential emergency situation. Try to eliminate any unnecessary things that you don't need while traveling. Like, for example, if your patient could be off tube feeds for 15 minutes, or maybe you have some IV drips that you don't need to bring with you, you can just leave those back in the room, do it. I try to condense everything down. So if I have multiple IV poles, I'm going to try and only bring one IV pole if possible, just to make my road trip easier. A lot of times we're short staffed. We don't have a lot of extra hands. And sometimes it's just me, or me and a respiratory therapist, or me and just another nurse traveling with this patient. So we need to condense things down to make sure we don't need a million extra hands. I also think it's really important to let somebody know when you are leaving the unit. Obviously, you need somebody to watch your other patients if you have other patients, but just in general, tell your charge nurse, tell your neighbor, or somebody around you, like, hey, I am taking this patient to CT or whatever. So that way, God forbid something happens and there's an emergency and it's called overhead, they know that that is you. And when you get back, you'll get your patient situated, untangled. It's part of just the process of transporting with ICU patients that have a lot of wires, tubes, drains, all those things coming out of them. But the important part is not that it's tangled and messy, obviously, whatever, but that we do it safely.